Welcome to Review Central. This is NCLEX Reviewer No.2, featuring questions on basic care and comfort. This reviewer is intended for those who are eyeing, or are set to take either the NCLEX-PN or the NCLEX-RN. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous NCLEX exams. Now let's begin. Question number 1. In a patient following surgery, which of the following features will not be part of the pain syndrome? A. Diaphoresis. B. Tachycardia. C. Hypertension. D. Hypothermia. The correct answer is D. Hypothermia will not be part of the pain syndrome in a patient following surgery. Signs of pain include sympathetic changes such as an elevated blood pressure, fast heart rate, and profuse sweating. Pain assessment includes many dimensions. The questions assist in determining the quality, duration, timing, severity, location, contributing factors, provocative or palliative, and any self-limiting implications of pain. Pain assessment involves being culturally competent. Culture influences the pain experience, coping mechanisms, and responsive behaviors. Pain is self-reported, individualistic in nature, and subject to bias. Question number 2. A patient in ICU is referred for physical therapy. The patient has had removal of a brain tumor and is sedated. The patient has a ventricular drain, is intubated, has a Foley catheter, and peripheral IVs. There are pulse oximetry, cardiac, and intracranial pressure monitors. Select the best intervention. A. Prom of the extremities. B. Sitting on the edge of the bed to work on a roam. C. Chest physical therapy. D. Postural drainage in Trendelenburg position. The correct answer is A. Prom of the extremities. In physical therapy, PROM or PROM stands for passive range of motion. This is the space in which a part of your body can move when someone or something is creating the movement, such as a massage or physical therapist. In the Trendelenburg position, the patient is supine on the table with their head declined below their feet at an angle of roughly 16 degrees. In the given scenario, the patient should only be treated with PROM. Chest PT and Trendelenburg are contraindicated. Question number 3. Which type of clothing is preferred by most patients with disabilities? A. Large zippers. B. Oversized clothes. C. Velcro closures. D. Slip-on stretchable garments. The correct answer is D. Most individuals with disabilities prefer slip-on clothing that is soft and flexible. They also prefer clothing that will keep them warm. They also care about personal appearance, so oversized clothes and Velcro are not as popular. Question number 4. Which of the following is the biggest contributor to constipation? A. 30 minutes of moderate exercise 4 to 5 times a week. B. Sedentary lifestyle. C. High-fiber diet. D. Plenty of water. The correct answer is B. A sedentary lifestyle greatly contributes to the condition of constipation. A high-fiber diet, plenty of water, and 30 minutes of moderate exercise 4 to 5 times a week will often relieve those experiencing constipation in short order. Question number 5. Which of the following safety issues is not considered an IADL? A. Responding to a carbon monoxide detector. B. Use of the 911 system. C. Mobility with a walker. D. Awareness of fire safety. The correct answer is C. IADL stands for Instrumental Activities of Daily Living. IADLs are things you do every day to take care of yourself and your home. They are one way to measure how well you can live on your own. On the other hand, ADL stands for Activities of Daily Living. ADLs are basic self-care tasks like bathing. IADLs require more complex planning and thinking. Mobility with a walker is an ADL, while the other answer choices are all IADLs. Question number 6. Which of the following meals is most appropriate for a patient with hypertension? A. Hamburger and French fries. B. Ham sandwich on white bread and an apple. C. Grilled chicken breast, carrot sticks and a roll. D. Cobb salad with ranch dressing and glass of water. The correct answer is C. Patients with hypertension may benefit from a low-calorie, low-fat, and low-salt diet. Among the given choices, grilled chicken breast, carrot sticks, and a roll are recommended for a patient with hypertension. Processed and cured meat products are high in fat and sodium. Question number 7. A patient has a stage 2 decubitus ulcer over the sacrum measuring 1.5 centimeters. There is no discharge, odor, or surrounding erythema. Select the most important treatment to promote healing. A. Hydrotherapy. B. Oral antibiotics. C. Avoiding pressure. D. Hydrocolloid dressing. The correct answer is C. Avoiding pressure. Decubitus ulcers are caused by pressure, leading to ischemia. Frequent turning of immobilized patients is needed for prevention. Once an ulcer has formed, avoidance of pressure over the area is needed for healing. The area should be kept clean and moist, so hydrocolloid dressings can also be helpful. Question number 8. What is the best position for a Foley insertion in a patient who is unable to lie flat due to respiratory distress? A. Reverse Trendelenburg. B. Trendelenburg. C. High Fowler position. D. Head at bed elevated 30 degrees. The correct answer is A. Reverse Trendelenburg. In the Trendelenburg position, the patient is tilted with head downward, not good for respiratory compromise. Raising the head of the bed 30 degrees will support respiratory efforts but not catheter insertion. High Fowler supports respiratory efforts but is not a good position for Foley insertion. Reverse Trendelenburg allows the patient to lay flat while the bed is tilted to where the head is in the upward position to support respiratory efforts. Question number 9. A patient with multiple sclerosis is able to clean her house but it exhausts her. She cannot afford a maid. Select the best recommendation to make. A. Suggest that the patient alternate sitting and standing tasks. B. Recommend a part-time maid. C. Recommend strengthening exercises. D. Encourage her to loosen her requirements for how clean her residence should be. The correct answer is A. An energy conservation technique that may be of help would be to alternate sitting and standing tasks. Encouraging patient to loosen cleanliness standards is not appropriate as it may result to other problems. It also infringes on patients' personal preferences. It would not be appropriate to urge the patient to hire a maid since she cannot afford one. Although strengthening exercises may be helpful, the issue is endurance. Question number 10. This is the last question for this reviewer. Which of the following is the best evidence of healing of a pressure ulcer? A. A non-erythematous base. B. Epithelialization. C. Lack of purulence. D. Lack of a fever. The correct answer is B. Epithelialization of the ulcer is the best clinical evidence of healing. Epithelialization is a process where epithelial cells migrate upwards and repair the wounded area. This process is the most essential part in wound healing and occurs in proliferative phase of wound healing. You have just completed NCLEX Reviewer No.2, which featured questions on basic care and comfort. If you wish to watch more NCLEX reviewers on basic care and comfort, check out our NCLEX Basic Care and Comfort Reviewers playlist. Check out also our other NCLEX playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful and feel free to share to anyone who may also benefit from it. We wish you all the best on your forthcoming NCLEX.